Hi, I'm Dr. Rachel Marston, audiologist and owner of Audiology of Apex in Apex, North Carolina. I want to talk to you about something I saw in the comments of one of my previous videos. I posted something about the common causes of tinnitus or ringing in our ears, and I saw in the comments that a lot of you were reacting to the fact that you had an increased perception of this or experience with this when you were sick with COVID or other illnesses. And I wanted to go over what happens when a virus gets in our ear or affects our hearing this way. There's really two things that can happen. The first is we get an ear infection. And sometimes illnesses can lead to upper respiratory infections or sinus infections that close our eustachian tube, that little tube that's responsible for equalizing the pressure in our ear, that little tube that you chew gum on planes to equalize or pop your ears so that they don't hurt when we get up in the sky. That can get stuck closed because of the illness. And when it does get stuck closed, you end up with fluid in your middle ear, what you would think of as an ear infection. The second is the virus can actually get into your cochlea or your hearing organ. When that happens, we start to feel stopped up, or we notice increase in tinnitus because our auditory nerve and our brain are going to react to that. They are going to have a response, and that response for a lot of people is ringing or buzzing sounds. Sometimes when we get better, that goes away. Sometimes it doesn't. But the most important thing is if you notice that your hearing changes suddenly when you're sick with COVID or the flu or really any kind of virus, you notice this sudden change in one or both of your ears, follow up with your doctor right away. There are certain sudden hearing losses that can happen from a virus that if you treat it within the first 24 to 48 hours, you can get that hearing back. So if you feel like that's happened to you, make sure you call urgent care or your primary care or somebody right away, get tested, make sure you don't need that treatment so that you don't lose that hearing permanently. Know your hearing health.